welcome to my YouTube channel. So today we are going to talk about a very special topic, which is thromboangiitis obliterans. So it is one of the vasculitis disease. Vasculitis means nothing but it's just the vessel wall inflammation, and it is a type of vasculitis. So it is also known as Buerger disease. Okay, and it's a very special disease because every characteristic of it is given in its name itself. So if you decode the name, you will get all its characteristics, so it's very easy to remember what will happen. And this disease, it is seen in mostly heavy smokers. Okay, in heavy smokers you will see this disease, and it occurs usually before the age of 35 years. Okay, so it's very easy to remember this. So first is, you will take the word angiitis. So what is angiitis? That is a vessel wall inflammation, and here you will see both acute as well as chronic inflammation happening. Okay, so you will see both acute and chronic inflammation happening in the vessel wall. And what is thrombo means? Thrombus formation. So in the vessel wall you will find thrombus formation, and you will find acute and chronic inflammation in the vessel wall. Okay, and in the lumen you will find thrombus formation. So obliterations means in that way it will obliterate the arteries. Okay, and most commonly it will obliterate, or this occurs, inflammation occurs in the tibial and the radial arteries, or the arteries of the extremities. Okay, so if you want to talk about the morphology of it, what you will see is, you will basically see a vessel wall in which you will see acute and chronic inflammation happening, and you will see a thrombus inside it, and the thrombus will contain minute abscesses, okay, or multiple microabscesses. And as you guessed it, this microabscess contains both neutrophils, which are the marker of acute inflammation, and it will be surrounded by granulomatous inflammation, which is the marker of chronic inflammation. Okay, so you will see that. And the other thing that will occur is, this inflammatory process, it will invade the veins and the surrounding nerves as well. So in the later stages, all these three things, the inflammatory process, the veins and the nerves, they will be encased in a fibrous sheath. Okay, now let's talk about the clinical manifestations, which are very easy. So I already told you it will affect the extremities, okay, or the radial and the tibial arteries, which are supplying the extremities. So what will happen is, if it is obliterated, okay, if it is obliterated, you can guess the symptoms yourself, that it is obliterated means it is not getting the oxygen, it is not getting the blood supply. So that will be the symptoms. So first you will see Raynaud's phenomena. So what is Raynaud's phenomena is, during the cold period, okay, your vessels itself, it will undergo vasospasm, but already there is obliteration occurring because of the thrombus. So because obliteration is already occurring because of the thrombus, and it is undergoing vasospasm, the blood supply to the fingers and the toes, it will be so less that it will undergo numbness. Okay, it will be all cold and it will be all numb. Okay, that is Raynaud's phenomena. So you will see Raynaud's phenomena. And second, you will see claudication. So what is claudication is, it's just, now I used to remember it, it's just angina of the leg. So basically what it means is, so because obliteration has occurred, and more than if we remember that if more than 70% obliteration has occurred, that is called as critical stenosis. Okay, just like that in your legs. Okay, if more than 70% obliteration has occurred, or let's say more obliteration has occurred, then what will happen is, during the time of exercise, the blood supply, it will not be enough. Okay, the blood supply, it will not be enough, and your legs, it will start to ache, it will start to pain, the muscle in the legs will start to ache if you do exercise. But if you take rest, you will be all right. Okay, but when it is active, it will start aching because you require more oxygen during the period of exercise. Okay, so that is called as claudication. Okay, and here so during the exercise it will ache. Okay, but here sometimes during the rest also it can ache, because as I already told you that it is invading the vein and it is invading the nerves. So because it is invading the nerves, it will lead to pain. So it can lead to pain even at the time of the rest. Okay, so that is all I have for you. It is a very simple topic and it was very easy to understand. Hope you liked it. Thank you so much.